Sean, if this is too loud, will you be the one to come help me? Okay. Hi, everyone. I'm April Holman with the Alliance for a Healthy Kansas. We are really glad to have you here for a conversation about Medicaid and about the potential cuts that we're hearing from Washington, as much as $880 billion over the course of the next 10 years. We don't know what those cuts are going to look like yet. They're still having those conversations in Washington about what the makeup of those cuts will be, but we know with a cut that high that there's no way that it can be done without terminating coverage for people in Kansas and across the country. So we wanted to have this opportunity for people here in the 1st District to talk a little bit about what your concerns might be in the light of these cuts. We have invited the congressional delegation members that represent this part of the state. So both senators and Congressman Mann. We actually have someone here from Congressman Mann's office. So we're thankful to have Dawson Moran here to listen and hopefully report back on what you're hearing from the people here in Salina. So the way this is going to work is that we have some people who have already signed up to speak, and once we get through that list, we're definitely going to open it up for other people. We do have a 1 hour time limit. We've kind of promised, as far as the video feed that we're doing, that it will be 1 hour, and that's another thing that I should share with you. We are going to be taking some pictures while you all are here. We're going to be live streaming, and that's open to the public on the Alliance for a Healthy Kansas Facebook page. We are sending the links to that stream to all of the congressional delegations so that they can see it, even if they're not able to be here right now. And we're also going to compile some of the comments so that, even if people are not able to watch them, they'll still be able to hear what those concerns are. So if you feel uncomfortable having your picture taken or being in the videos, I wanted to give you that information up front to give you the chance to step out if that's not something that you want to do. Okay, so we're going to go ahead and get started. I would ask everyone to try and keep their comments to about 5 minutes or less so that we can be sure to get everybody an opportunity to speak who wants to. And the first person on the list is David Norland.
All right.
Of course. Go David.
Let me just say, it's nice to see you all here, and I am sure that I could be no more eloquent than any of the rest of you can be. I think that certainly we in this room have heard each other's voices. We've heard each other loud and clear. And no offense to Dawson, I'm eager to hear from him if he has anything to say, but Tracey Mann should have his posterior here. He is from Salina. He has no good reason not to be here, and yet he is not present.
Amen.
So this would be to Mr. Mann and to our senators. I don't have a specific story, partly because they are so innumerable, but we have been laboring in the trenches as Kansans, waiting for our legislature to take action to be part of the Medicaid expansion. For Lord knows how many years have we been wandering in the wilderness waiting for that to happen. And yet nothing. There's not just a drought of rain in this state, there's a drought of committed humanitarian representation from this state. And those representatives need to wake up, smell the coffee, and get into action. There are, in this audience, many committed people from social service organizations who see daily the result of our not having Medicaid expansion. And, hello, you can't be blind forever. Wake up. Thank you.
I think we've heard this. So this is at the third meeting that we've had. We were in Topeka on Monday night and Wichita last night. And a lot of times we hear that people are saying we actually need more Medicaid as opposed to less Medicaid. And I think the conversation about Medicaid expansion, although that's a state decision, kind of reflects that rather than seeing those cuts, we'd like to see more of it. Thank you. So the next person who signed up was Matthew Appel. Is that you? Apple? I'm so sorry. Yeah, would you like to speak? Okay, very good. The next person who signed up was James Bent. Are you James?
Yep. Good evening. I'll be back. Don't go away. I wrote down what I want to say so I can keep it short. My story is that I received healthcare services at the VA clinic here in Salina. To receive needed specific care that can't be provided at the clinic, I may go to the big VA hospital in Wichita or to the Salina Regional Health Center. All the care that I have received via this system has been more than satisfactory, prompt, and to me personally, free of cost. The only out of pocket expense that I have is having my teeth cleaned, routine maintenance. My story is that having access to affordable, professional, comprehensive, and actually accessible healthcare directly translates into significantly improved quality and quantity of life. So that's me. So in extra credit, this is a book that's available here in the library, Dying of Whiteness. It's published in 2019 by a man who's a psychiatrist. And the subtitle of the book is How Politics of Racial Resentment is Killing America's Heartland. So he looks at 3 states, Missouri, who increased access to firearms, which was followed by an increase in suicides among white people. He looks at Kansas, which Brownback's tax cuts immediately resulted in a significant drop in the quality of education in the state of Kansas. And then also Tennessee, which did not expand Medicare. And so his one statement, one quote, and I'm done. He writes, "Many white men voted a willingness to die, literally, rather than embrace a law that gave minority or immigrant persons more access to health care, even if it helped them as well." That's it.
Thank you. Thank you so much. I really appreciate it. The next person that we have is Heather Brom.
Thanks, April. My name is Heather Brom, and I work for the organization called Kansas Action for Children. It's based in Topeka, so I did drive 2 hours to be here to speak, because what we do at Kansas Action for Children is we advocate on behalf of kids and families across our state, particularly lower income families. And a lot of what I do is talk about Medicaid, the importance of Medicaid for all children, for pregnant women in Kansas, for our very, very low income parents of these kids, because Kansas has not yet expanded Medicaid. So just a few thoughts I've written down. Kids are our future. We should want them all to have the best chance at growing up healthy and thrive in their communities. And Medicaid plays a role for many of those kids throughout our state. It helps them, get their well child visits. Families pay for their well child visits, for prescriptions that they need, for when they catch that virus at childcare or at school, going to get that temporary health. It helps pay for hospital stays, so families don't go bankrupt. If you have a baby born who needs a NICU stay, when you're on Medicaid, you're not having to worry about bankruptcy. Make sure your child lives. It pays for vaccines, to protect kids from disease. It pays for interventions for these kids, because we know when you intervene in early childhood for health issues, kids have much different outcomes in life. You intervene early and you can sometimes eliminate speech defects, brain development issues, physical issues, or if you can't fully eliminate those, you can at least help the child so they thrive in life. At the Topeka event on Monday night, there were a number of parents, and I don't know if there will be tonight, but a number of parents who spoke about how Medicaid helps their special health care needs kids with complex medical needs that the private insurance will not cover the care that these kids need to live a full life. Many of these kids may have to be institutionalized if they didn't have Medicaid access to pay for services like nursing care at home. You know, we've got some of these kids that need to be on ventilators 24/7. Medicaid helps pay for that. And so before I close, one other group to talk about how Medicaid helps is parents. Kids need healthy parents to thrive in life. And so right now in Kansas, Medicaid pays for pregnant women to receive coverage during pregnancy and then up to a year after. For parents, because the state has not expanded Medicaid, that is parents below 38% of the federal poverty level. Does anyone have any idea what that translates to for a family of 4? Anybody know? It's about $12,000 a year. Household income. That's how low Kansas Medicaid eligibility standards are right now because we have not expanded Medicaid. So these federal cuts that are being talked about threaten the health and the well-being of kids, parents, pregnant women, and so many other populations in our state. And one other thing to end with, you know, you're going to hear a lot tonight about the health impacts, but I also want to bring up, if the federal government cuts Medicaid at the amounts that they are talking about, it is going to threaten our state budget. Kansas saw 10 years ago what happens when we see major budget cuts and shortfalls with funding. If the Medicaid cuts happen at what they are being talked about, Kansas may have to make up that difference in our state's budget. And that's going to impact our roads, that's going to impact our education system, and a number of other programs across our state. So it just asks that the senators and the representatives making the decisions think about what Medicaid means for every Kansan that program touches. Thank you.
The next person who signed up is the Reverend Mandy Todd.
Good evening, everyone. I am the Reverend Dr. Mandy Todd. I work for an organization called Kansas Interfaith Action. We are a statewide public policy office, and we do faith-based advocacy for people in Kansas. I am also the pastor at Messiah Lutheran Church in Lindsborg, Kansas. It is a fact. It is an undeniable fact that our God, no matter what you call that God, the divine, wants us to be healthy and whole. In all of our sacred scriptures, we hear calls for the divine to lift up people who are vulnerable, who are sick, who are in need, and for us, as God's creation, to do the same. As people of faith, we stand firmly on the side of healthcare as a human right, not just because we're humans, but because we are divine creatures. On a more personal note, I am a proud native of Kansas. I lived here until I was graduated from Bethany College, and then I moved to Colorado, and I lived there for almost 20 years. While I was working and serving in the state of Colorado, the global pandemic hit, and I lost my full-time job with full-time benefits. I was forced to gig my way to survival, and I worked 3 jobs as the pastor of a small church and an administrator of their preschool, as well as directing children's choir, the Colorado Springs Children's Choir. It was a lot, especially for a parent of 2 young children. The reason my children are healthy and happy today is because we had access to expanded Medicare in the state of Colorado. Had I stayed in Kansas through the pandemic, my family would not have had health care during a global pandemic that forced us to lose that health care. Health care is a human right. Medicaid in this state and across our country should be expanded so that no one is put into a position to be unhealthy, to be ill, to not be able to flourish as God wants us to flourish. Thank you.
Thank you. The next person is Corey Sherman North.
Hi, I wasn't going to tell our little Medicaid story in our family because I did think it was kind of little, but then I realized, it's a real success. It's a success. Medicaid intervention, helped out, done. It was great. We're just an average family, have health care through my work, but of course it became too expensive through my work to pay for all 4 of us at the time. So we did go on Affordable Care Act for the last 2-3 years. And we had the usual problems, but when my youngest son at home, youngest of 6, Will, started high school, he started off so great, lettered in cross country, gifted program academically. By the end of the year, he was in a severe depression. Really bad. And he stopped going to school, withdrew. And then we started him off in care here in Salina with a couple different outfits that are here that I'm sure you all know. But the pediatric psychiatrist here could not help him. We've been with him now for 2 years. And when Will started his sophomore year, he was, over 6 feet, but only 111 pounds. So not doing well. But that February of his sophomore year, so that would be 2023, he was able to get an SED waiver, severe, seriously emotionally disturbed waiver, and get on CanCare Medicaid. And that took care of all his medical bills, all the wild medications we were on, up and down. And then finally, that spring, we were also able to be referred down to KU Med Wichita in their psychiatry complex down there. And so he was helped. It's a long road, but Medicaid also was there for Will when he fractured his knee one night playing basketball at a church. We ended up having to be, ambulance down to Wichita's Children's Hospital for emergency surgery and get 3 pins in his leg, his knee and everything. And we wouldn't have been able to manage financially through all that because we also had other things going on in our family. Older sister also needed mental health care the year before Will did, and then husband Bill had a stroke Christmas 2023. So without Medicaid, I don't think we would have made it.
Thank you for your willingness to share that. Okay, the next person actually was coming from near Manhattan and was concerned about the weather, so she texted me what she was going to say. So hold on just 1 second, I'm sorry. Her name is Brenda Bandy, and she works with a group called the Kansas Breastfeeding Coalition, and also the first 1,000 days. She says parents are very worried that right now congressional leaders are considering a proposal that would make massive cuts to Medicaid. Medicaid covers 30% of births in Kansas. Any reduction in Medicaid will impact these families. In too many rural communities, families must already drive hours to give birth due to hospital closures or loss of maternity care services locally. If cuts are made to Medicaid, it will put more rural hospitals at risk of closure. More families will have to drive greater distances to give birth. This puts not only the mom and baby at risk, but impacts their ability to get care after birth. Medicaid is important to moms and babies in Kansas, and we must keep them in mind when considering cuts. Medicaid covers vital services to new moms and babies. We have heard from families who have said they will forego prenatal visits and important postpartum visits if they have to pay for them out of pocket. We know that moms will always prioritize their baby's care, meaning that moms will go without the care that they need if forced to choose what medical bills to pay. Maternal deaths are already too high. Cuts to Medicaid would only make this situation worse. I urge legislators to protect Medicaid so Kansas families and those across the U.S. continue to have access to the health care they need. All right. Is there anyone else? I don't think I missed anyone who had signed up. But we now will open it up to people, and Dr. Davis was the first one who raised his hand.
Probably
Come on
the
up.
last one to sign. I didn't sign up until about an hour ago.
Oh, that's probably why. Yeah, you're right. Okay, so I have one printed out from earlier. But if you wouldn't mind coming up so that you can use the microphone.
I'm not sure if I should talk to you as a medical provider, an uncle of a young niece who my wife and I were guardians for several years, who were not admitted without Medicaid, or as a city commissioner, or as a consumer who pays health insurance benefits, because they're all tied up with Medicaid. The idea that we would have less Medicaid is reprehensible. It's bad enough that we don't have expanded services now. Sick people don't work. And that's a problem for me as a city commissioner, because the biggest problem we have is we have jobs that are unfilled right now and nobody to take them. We have workers at home, but young workers can't go to the workplace because there's no child care. There's not enough child care because the child care operators can't afford to pay the teachers. You know, simply, if the teachers were eligible for Medicaid, that saves, the operator $4 or5 an hour of overhead. But when people are sick, they don't go to work because they're sick. So that decreases our, if you want to call it a gross national product, a gross community product, if there is such a term. Not just for that individual family, but also for our community. We have too many people at home who could be working but can't because they can't get medicine, so their health conditions go untreated. They don't feel like working. A few years ago, and I hope this has changed, somebody proved me wrong, this was the only state in the United States that did not cover sleep apnea treatment for adults. So you have people who are sleepy, tired, having accidents, can't go to work, they can't remember, have headaches, just because, we were penny wise, pound foolish in not covering treatment for something very simple and very common. Most people who fall in the Medicaid gap in Kansas are hard-working folks. They're working 2 jobs, may have kids, but neither job pays enough to afford a Blue Cross policy. So they go without insurance. And again, if you're not covered, if you're not seeing the doctors, sooner or later you're going to get sick or have a catastrophe that doesn't get treated, and you're permanently out the workforce. There's this perception that people on Medicaid are deadbeats. That is just so far from the truth. The other problem I'm having as a physician is that the services we have now through the 2 or 3-headed monster that runs Kansas Medicaid puts an onerous restriction on medications, services. I spend 30 minutes seeing somebody, and I'm not exaggerating, 45 minutes on the phone trying to get their MRI and their medications approved. I can't do that. My boss isn't gonna like it because he can't bill for that telephone time. So what happens, eventually people don't get services. I've learned to be mean and ornery on the phone. So I'd like to think my success rate is kind of high, but that means I'm staying late making up for that paperwork elsewhere. The other problem is Kansas doctors are now withdrawing from being Medicaid participants. West of Manhattan, there are 3 neurologists who see Medicaid patients. 2 are in Salina, 1's in Newton. So I have patients who live in Wichita. Their doctor's across the hall from the neurology office there. They have to drive 100 miles to see me because no one in Wichita takes Medicaid. Because doctors are just tired of dealing with it. So to even think about decreasing the services we have would be reprehensible. I mean, I'm sure folks would consider just saying, heck with that. For all of us who pay insurance premiums, every time your hospital takes care of someone who doesn't pay, it offsets that cost by charging a higher premium for the other insurers. So everyone in this room who has insurance, you are paying for the uninsured in this state. Now, for some reason, Kansas, by not expanding Medicaid, is still sending federal dollars to Washington, D.C. so that all the states around us can use that money for their expanded Medicaid. It's just an ass-backwards way to do business. It is the cheapest investment that we could possibly have in this state as an economic development tool, if you want. If you got to look at it in terms of dollars, it will grow business, aside from the health benefits. But we just can't let this pass. Everyone in here has a stake in this, whether you need Medicaid personally or not. Thank you.
I think Dr. Davis brought up a good point, and that is, in Kansas, we don't have a lot of optional services that are covered under Medicaid. And so what if we had fewer Medicaid dollars because we had, for instance, a reduction in the amount of the federal match that came in for Medicaid, or there are some other ways that we would directly have that lower amount of money, then our legislature would need to make decisions about how they would come up with the difference. And what they would be left with if they were going to be cutting something, the voluntary things that they could cut are the waiver services, home and community-based services that help people who have disabilities stay in their homes, and help seniors who are not ready to go into nursing homes. It also, they would have the opportunity, if they needed to cut provider rates. And I think Dr. Davis was making the point that our provider rates are already so low that it's difficult to keep providers in our Medicaid system in Kansas. So that would be even tougher if we were to see those cuts. Okay, anyone else? Ron, would you like to speak?
Thank you, April, for the opportunity to be here this evening. I have 3 thoughts that I'd like to share with you this evening. The first thought is, I am not a paid agitator. I'm a retired music educator. I bought the gas to put in my personal truck to drive here this evening. My second thought is, my town does not have a hospital, but it does have an EMS. And I can get an EMS to my house in town in about 2 minutes. And I can get to a hospital in about 10. That EMS can get to the farthest edge of their service in about 5 minutes. And that person, from the farthest point to the nearest hospital, is 15. I think we're both going to make it. My family, my wife's family actually, is from western Kansas, and I'm familiar with a little town called Coldwater in Comanche County. Comanche County has 790 square miles. Coldwater has a hospital, 12 beds, but an emergency room and an EMS service. If that EMS service goes to the farthest edge of their service area, it's 15 minutes to get to the emergency and 15 minutes to get back to the emergency room. Chances go down. That hospital has a revenue stream, although it may not be huge, but they have a Medicaid revenue stream. And what happens if that hospital closes? It's 15 minutes to the emergency and now 45 minutes via ambulance to the nearest emergency room. Chances are going to go way down. So I'm going to say what everybody else so far has been too nice to say. You cut Medicaid, you're going to kill people.
Yeah, no.
So, Dr. Marshall, how many deaths will it take for you to say, I'm still okay trying to stay in political favor?
Good question.
My third thought this evening is also stimulated by Western Kansas, but just as true here in Salina County as it is in Harvey County or any other place. And that is, we have a senator that sits on agricultural committees in Congress. We have representatives that say that the agricultural business is vital to the state of Kansas. I cannot comprehend why our elected officials would even consider doing something that undermines the agricultural business and the ability for farm families to stay on those generational farms. You take the services, medical services, social support services, even transportation and gasoline and all those kind of things away, what's already diminishing will soon be gone.
Do we have anyone else that would like to stand up and speak? Perfect.
Good evening. My name is John Blanchard. I know most of you in here, but I'm going to kind of follow up on some of what Dr. Davis said. And first of all, I know I'm talking to friends and neighbors here. But I do, if I understand correctly, this is going to be forwarded to legislators and our congressional delegation. I want to speak to them. And as a former elected official, and I want to appeal to their better angels, is basically when I speak to them I want to do, and just ask you why it is that you decided to become a representative or a senator or whatever your choice was. Was it to help people, or was it for some other purpose that would probably be more self-serving? I'm hoping and I'm assuming that most of them wanted to be there for a public good, and it's kind of a little bit heartbreaking when I look at kind of what folks closer to the local level feel when they're dealing with their communities. We don't have an extremely wealthy community. We have a lot of people that are kind of operating in the margins all the time. They're paycheck to paycheck. They need good quality health care, and they can't afford it. And they keep trying to get ahead, and they can't get there. And so what I'd like for at least our state legislatures, let's get this care expansion going. We talk a lot about affordable housing. We talk a lot about the need for child care. We talk about the need for more workers and good quality jobs. It all starts with healthy people. And we need to expand it's an economic development initiative. We always hear about everything's economic development. It doesn't matter what it is. It could be public art or whatever, but it's always made the case for economic development. Well, early childhood development is the biggest economic development driver we could possibly ever have. And by not having healthy parents and raising healthy children, it's just wasted money. So if we can get this done, then we're going to be miles ahead. And we always hear about we can't afford it. How are we going to pay for it? We can't do this. Well, you know what? Governor Kelly helped get the sales tax off of groceries. And you know what? We're paying for that. We can do difficult things. We need you guys to have the courage to do these things. Your terms are going to expire quicker than you can imagine. And I hope that you don't, at the end of those terms, sit back and go like, boy, I wish I would have fought for people because that would have really meant something to me and my legacy. So be a little bit selfish, think about your legacy, and do something good for the people that really need it. And I'm just going to put a plug in for an organization that I work for because it was part of the email that I got. We're trying to start up the Boys and Girls Club in Salina. And and there's a number of people that are working really hard to get that done, and it's going to happen. But these are the kids that are predominantly affected by that, and Boys and Girls Clubs and other organizations that help kids and people that need it are funded by a lot of the stuff that people are wanting to cut. So I just want to, this whole government efficiency thing, that's great, and people want to save money and everything. But let's just remember that preventative health care and healthy people create more efficiency than you can ever imagine. So please get this Medicaid expansion done. And if you need help and tours around the city, legislators, give me a call. We'll take you around and show you where the people that need it are. Thank you.
We've heard a couple of people now talk about Medicaid expansion, and I think that's really interesting because one of the things that has been talked about the most in Washington about cutting is Medicaid expansion. So there have been proposals to take away the enhanced match that allows Medicaid expansion to be affordable, and we know that if that happened, we would never have a chance of having Medicaid expansion here in Kansas. So I think it's really interesting to hear that people want more investments in Medicaid rather than less, and also that Medicaid expansion is still something that Kansans want to see happen, and it couldn't happen if those were the way, if that was the way that cuts were orchestrated in Washington. Okay, would anyone else like to speak? Yes. Oh, I'm sorry. You're definitely next. No. After. Okay. Yeah. Thank you.
I'm Tracey Myers, and I'm a marketplace navigator, and I'm out of Clay County. I serve 8 counties. I also work a lot with CKF down here in Salina. I see a lot of folks that end up in the Medicaid gap. And it's just really heartbreaking because they're not dirt poor, they're not lazy, they have jobs, they make too much money because they make over $12,000, and yet they can't afford health care. They don't get the tax credit in marketplace, so they have absolutely no insurance. And so they don't go to the hospital, they don't go to the doctor because they can't afford it. Recently, a government grant, federal grant, was cut for the opiate grant. So we've got people that can no longer get their medication for substance abuse and what they've relied on. So I am trying to help those folks. Some of them don't qualify for Medicaid. So I try to get them into a marketplace plan that they can afford. If they don't have a job that pays at least $18,000 a year, they don't qualify for a tax credit, period. And that's the full premium that they have to pay. When you're on a Social Security, you only make $1,100 a month, and you have to pay an $800 premium? You can't. There's no way. And so many of you have talked about being unhealthy. We're going to be so unhealthy if they don't expand Medicaid. I talked to our representative today, and he asked me this, how you doing? I said, you don't want to know. I said, your representatives need to come to work with us for a week and see, because it's so heartbreaking when I can't help somebody. I do help a lot of people, but there are the ones that you always remember that you can't, and that needs to change.
I think that one of the things that you didn't say is that there's been a huge cut to the budget for navigators.
Yes.
And so it's going to be that much harder for people to be able to figure out even what they might qualify for in terms of Medicaid or other programs, the marketplace subsidies, because there just aren't going to be the navigators here in the state. They have those cuts are going to go in place at the beginning of August, and it's a 90% cut in the funding for that. So it's really significant. Yes.
Hi, I'm a Kansas nurse. I graduated in 1978, and I have been working in the field ever since graduation. And so I've worked in all sorts of parts of the field. I've worked with special needs children that were on the ACIL TA waiver. I've also worked on an inpatient rehab unit here in town, and that's kind of where I want to start. We took care of a gentleman there that was a VA recipient. He had been homeless. He'd been helped to have an apartment because of VA services. He had a stroke. He had a very devastating stroke, and he came to our unit after being saved from that stroke. Unfortunately, we couldn't even identify family members. We couldn't even find a name for next of kin. And we knew that he'd had a severe stroke. He was going to end up needing nursing home supports. And so here I'm telling you, VA services, Social Security, because we didn't know his Social Security number, Kansas Medicaid, he needed a guardian, okay? That was a very complex case. But through those services, we got him into a nursing home for long-term care after his stroke, and that was his home, okay? I cannot imagine what Kansas communities are going to look like when those services fail. Because nursing homes will be saying, wow, we can't afford to keep this old person around, you know, and they need help rolling from side to side in their bed, but I don't know what we're going to do for them. That's how horrible our communities are going to look. I'm going to leave that there because, believe me, that's the kind of stuff that rolls around in my head sometimes when I can't sleep. It's going to be that horrible. The other thing I want to say is that privatization of Kansas Medicaid has been a failed experiment, and it's time to give it up, okay? Because the impetus for the contracting units, usually insurance agencies, to make profit, steals services from Kansans. I am so old that I worked with the system when, if a patient said to me, well, my special needs child, will Kansas Medicaid cover this? Will it cover my kid's Botox? I could say confidently yes. Because I didn't say, well, it depends on whether you chose box A, B, or C. I don't know. You know, I didn't have to say that to them. Let's just quit pretending that privatization solves problems. It creates problems, and the profit motive steals services from families.
Thank you. Would you like to talk?
My name is Chelsea, and I work for a treatment center here in Salina, and I work with our youth primarily. And I have children who are waiting 3-4 months to be able to get into treatment for their addiction. I have children who are in need of treatment but their parents can't afford to send them. They don't qualify for Medicaid. their parents don't have insurance, and I have children who are overdosing and dying in our community, ages 12 to 17, during every week, you know. They're experimenting, and you know, years ago we could experiment and not have to worry that we were gonna die. Now kids are experimenting and they're dying. And without the expansion of Medicaid, without affordable insurance, we are unable to get our adolescents the help that they truly need. And so just thank you. Thank you so much.
Okay, y'all, I'm nobody important, just an old great-grandma. You're gonna cut, they're talking about cutting Medicaid. That is going to devastate communities economically. Expansion of Medicaid, Medicare will help those communities thrive economically because you can't, you know, the old saying, it takes money to make money. That's exactly what that does. So don't tell me you care about old people if you're not doing that. Don't tell me you care about the physically disabled, the mentally disabled, if you don't do that. Don't tell me you care about our children if you don't do that. Don't feed me defecated material and call it chocolate cake.
Thank you. Thank you. Is there anyone else who would like to speak this evening? Yes.
I'm Tracey Weaver. I'm here from Salina. Just a few years ago, I was at a meeting of the Democrats, and we invited Republicans to be there to speak also. And so one of them did show up, and so we asked him questions, and I asked him a question: why aren't we expanding Medicaid? How come you're voting against it? Can't afford it. Okay. So I brought up the issue of, I have a niece who several years ago, she and her husband, hardworking people, they had 3 kids. The children luckily qualified for Medicaid, but the parents did not. They made just a little bit too much money. I don't understand how all that works, but anyway. So when the parents would have any kind of health problems, like my niece had problems with migraines and other health things, but she could not afford to go to the doctor. And so I asked this representative that's there, what do you suggest I tell her? Where should she go? And he said, well, you know, she could go to the hospital. They have to see her there. They can just go to the emergency room. And I thought, well, isn't that a great solution? I mean, hospitals are, you know, they have a lot of people that can't afford to pay their bills, and so they don't. And some of these people aren't paying bills, go into bankruptcy because of the money they owe. I mean, that's, you know, he's encouraging people to, and I think it was because he couldn't think of anything else to tell me. You know, he had no answer. And I won't say who the representative was. He's not my representative, but he's one of our Kansas people. So anyway, that was just, I mean, I kind of had a personal connection with someone that I love that could not afford to go see the doctor. I don't know what's going to happen with this, but I so much appreciate the work of Expand Kansas. You people work really, really hard, and I know it's been a struggle.
Thank you so much. Yes, we spend a lot of time talking about Medicaid expansion at the Alliance for a Healthy Kansas. Right now, we're branching out to talk about how important Medicaid is overall and the ways that that is serving Kansans today. And we have concerns that if it were to be cut by the amount that has been thrown around in Washington, that could really, really set back people here in Kansas who are receiving it And we already have issues with people not being able to access the affordable care they need. So I'm really grateful for all of the people who have raised that issue. I want to give one last chance if there's anyone who wants to speak. Oh yes.
I'd like to speak for this
Can
gentleman.
I give you the microphone?
Yeah.
So.
He asked me to read this for everyone. He said, almost 6 years ago, my doctor told me I had less than 6 months left to live. I found a clinical trial at KU Med. As you can see, it worked. He's sitting here. Thanks to Medicaid and ongoing research by our scientists, I am alive, fairly healthy, and happy.
Okay, I feel a little bit like an auctioneer going once, going twice. Oh, yes, please come up. Sorry.
Hi, my name is Jocelyn Jackson. I own 10 People in Need Payee Services. Here in Salina, we're a represented payee organization. My organization helps individuals who do receive Social Security benefits and cannot manage it on their own. So we deal with Medicaid issues all the time. We have clients who would not be in services through OCCK, New Horizons, Choices, because that pays for their home health-based care. We had a lady who lives on her own, very resourceful, lives in a wheelchair. If she didn't have Medicaid, she wouldn't have a way to get around because it broke. We had no way to pay it. $5,000. If you don't know, an individual who's on SSI, Social Security income, can never have more than $2,000 in resources. So they cannot get dental care because you have to pay for your dental care up front. Broken things like wheelchairs, vehicles, things like that, they can never afford to pay for it because they can't ever have more than $2,000 in resources. So without the help of Medicaid helping them take care of a few basic needs that we look at, they would be completely without hope.
Thank you.
Will we hear from Mr. Mann's representative?
Oh, would you like to make any comments? I think we're really grateful because he is here to listen and to carry information back. And so we're really, grateful that is happening, and the expectation wasn't put out that he would speak. So I don't want to put him on the spot, but yeah, I just want to say thank you. I think that the concerns that you all have raised are powerful. I know that things that you have said had never occurred to me even, and I do this work every day. So I think that it's been full of insights, and I'm just grateful for the courage that people have to come up and talk about their own situations and also share concerns about the people they work with. So with that, we are done tonight, but we're not done with this work. So we do have a sheet of paper with a QR code in the back. If people want to sign a petition asking Congress not to cut Medicaid, that would be great. You can also get there from our website, which is just expandcancare.com. And we will continue working to try and educate the representatives here in the 1st District and across the state about what the really devastating impacts would be if we saw those cuts. So thank you, everyone.